My name is Orville Chambers, EMT Jamaica Fire Brigade, and in this video we will be discussing the different types of shock. We will begin with cardiogenic shock. What is cardiogenic shock? It's a medical emergency that happens when your heart can't push enough blood to your body. It can be fatal if lack of oxygen leads to organ failure. You need treatment right away in a hospital. Symptoms of cardiogenic shock: confusion of or not being alert, fainting, shortness of breath, low P output, cool hands and feet, loss of skin color, fatigue, swelling in your belly and legs, poor appetite. Get treatment right away if you have any symptoms of heart attack. Other conditions that can lead to cardiogenic shock include inflammation in your heart muscles, myocarditis, an infection in your heart valves, endocarditis, an abnormal heart rhythm, arrhythmia, too much fluid or blood around your heart, cardiac tamponade, a blood clot that suddenly blocks a blood vessel in your lung, pulmonary embolism, a heart valve problem like torn muscles supporting your valve, or a replacement valve not working right, damage to the wall of or tissue between the left and right ventricles of the heart, injury to the chest. Healthcare providers may categorize cardiogenic shock in a number of different stages. These range from being at risk to being very sick. At risk, which is A, heart attack or heart failure, but no signs of shock, beginning low blood pressure or heart rate, classic C, need for medicine or devices to help get blood to organs, deteriorating, no response to medicines or devices for 30 minutes and getting worse, extremis, cardiac arrest that needs CPR, ventilator, and defibrillator. Next we look at distributive shock. Distributive shock or vasodilatory shock is a medical emergency where your body can't get enough blood to your heart, brain, and kidneys. This happens because your blood vessels are extremely dilated, flaccid, or relaxed, which brings down your blood pressure and cuts down on how much blood can get to your organs. Often the small blood vessels, capillaries, are leaky in this distributive shock, resulting in some fluid loss from circulation. There are three types of distributive shock. Septic shock from a bacterial infection, example a serious infection complication called sepsis that gets so bad it leads to septic shock. Anaphylactic shock from an allergic reaction or asthma attack, example an allergic reaction to peanuts that leads to anaphylactic shock. Neurogenic shock from a spinal cord injury that damages your nervous system, example a diving accident that injures your spinal cord and leads to neurogenic shock. Next we look at hypovolemic shock. Hypovolemic shock is a dangerous condition in which the heart can't get your body the blood and oxygen it needs to function. This happens because you've lost large amounts, more than 20% of your blood volume. You can also get hypovolemic shock from losing large amount of fluids after a lot of diarrhea, throwing up, or sweating. During hypovolemic shock, at first your diastolic bottom or second lumbar blood pressure increases as you keep losing blood or fluids. Your systolic, the top or first lumbar blood pressure, comes down. Hypovolemic shock can affect anyone who's had traumatic accident that causes a lot of bleeding, a loss of fluid from throwing up, sweating, or having diarrhea. It can also affect anyone, and any of these can lead to hypovolemic shock. Fewer than 1 out of 1,000 people gets some type of shock. Hypovolemic shock is the second most common type of shock and most common type in children. You get this from diarrhea in undeveloped nations. There are 4 stages of hypovolemic shock. You lost 15% of your body's blood. Second stage, you lost 15 to 30% of your body's blood. Third stage, you lose 30 to 40% of your body's blood. And fourth stage, you lost more than 40% of your body's blood. Your blood pressure is low and your heart rate is high. You are producing very little or no pee. Some symptoms of hypovolemic shock: breathing faster than normal, feeling confused and anxious, sweating a lot, passing out, having skin that feels cool, feeling weak, having low temperature and low blood pressure, having a false pulse. Major blood or fluid loss causes hypovolemic shock. You may be bleeding a lot inside your body where you can't see it, or outside your body where you can see it. Obvious injury. You can also get hypovolemic shock from burns, pancreatitis, or from too much sweating, throwing up, or diarrhea. Types of bleeding that lead to hypovolemic shock include bleeding from a traumatic injury, surgery, ectopic pregnancy, and aneurysm that bursts. And this is a presentation of different types of shock.